anxiety in childhood and adolescence is perfectly natural and to be expected.
Hello, Dr. Etkin. Thank you so much for joining us today. I'm so excited to talk about your research.
Thank you so much for having me. I'm really excited to be here as well.
Okay, so to kick us off, why don't you tell us just a little bit about who you are as a person and tell us a little bit or a lot more actually about your research.
Sounds good. Yeah. So I am a licensed clinical psychologist and I work primarily with children, adolescents, and their families. I work at the Yale Child Study Center, and specifically, I am within the anxiety and mood disorders program. So we are definitely a specialty program that really focuses on anxiety and helping anxious kids and their families. And I am also a postdoctoral researcher. So my research focuses on really understanding the interplay between youth's closest relationships. So, in particular, their relationships with their parents and their friends, and sort of the qualities and features of those close relationships and their mental health outcomes. So, my research broadly focuses on understanding how do these relationship features impact youth's levels of anxiety, shyness, social withdrawal, and then how those in turn impact the nature of their close relationships. And of course, more recently, I've been really focusing in on anxiety and anxiety disorders.
Wow, that's fantastic. And it's very, very specific, those interpersonal relationships and connections and how much of an impact they have on the developing brain.
Exactly.
Okay, so kind of talking a little bit more about anxiety. Kind of give us an idea, to a parent that might not be totally sure, right? Like something's going on, I'm not quite sure what it is. Could it be anxiety? What would you want that parent to know about childhood anxiety?
That's a great question, and one that we get very frequently in our program. So, of course, the first thing that we want parents to understand is that anxiety in childhood and adolescence is perfectly natural and to be expected. We often say that part of being human is experiencing anxiety, and I think we can sort of all relate to that, especially in recent years. With all of the anxiety provoking things going on in the world, that anxiety is a natural and normal response, and it's good and okay and healthy to have it from time to time. When we start to become concerned that the anxiety has risen to the level of being classified as a anxiety disorder is really when the level of distress has risen sort of to out of proportion to what the child is anxious about. So let's say a child is crying often, is constantly experiencing somatic symptoms like stomach aches and headaches because of their worry. And importantly, we want to know if the anxiety is causing interference in their ability to do the things they want to do and need to do every day. So it's normal to experience kind of transient, fleeting anxiety from time to time. But if it's really sticking around, causing a lot of distress and getting in the way of what kids need to do, and that can range from things from going to school to having a play date, right? If the anxiety is making it hard for kids to do those things, then we might want to do more thorough evaluation to see if it's an anxiety disorder.
So in anxiety, we talk a lot about the fight or flight experience, right? With anxiety, that's exactly what it is. And I'm more curious to know, kind of along those same lines of what we've been talking about, but what can happen internally, like a little bit more of like the somatic symptoms that you talk about in terms of like stomach aches, right? Because we can look externally and we, say, oh, like something definitely is going on, right? That's not okay. But I think sometimes parents and even clinicians can miss maybe more of the internal. What are some additional internal symptoms that could be a sign of maybe more problematic anxiety?
Yeah, I think that that's a really great question, especially given that a lot of kids, especially younger kids, right, can say that they don't feel good or they're kind of showing parents that they don't feel good in some way, but they have a harder time actually verbalizing that they feel anxious or worried, or even more specifically, what is making them feel anxious or worried. And so sometimes we refer to these kind of more somatic presentations as body clues, right? That kids can kind of start to identify, okay, I have a stomach ache, and that stomach ache might be because I ate something that made me feel a little sick, or maybe that stomach ache is because mommy had to go to work and that makes me kind of nervous. And so again, if your child is consistently showing these symptoms, like stomach aches and headaches are certainly, I would say, the most typical, but it's also things like muscle tension, right? Like if we're, you brought up fight or flight. So when we feel anxious, our body is literally preparing us to run away or to fight, right? And we teach kids about this, right? Like if a tiger jumped into the room, it would be a good thing if our body sent us a signal to get ready to fight or to run away. But along with that, our heart starts racing so that blood is pumping throughout our body and we can run away more quickly. And we might start hyperventilating because we need to take in more oxygen. So when we run, we have air to breathe. But if there's not really a tiger, those things just make us feel tense and icky and sweaty and tired, right? So these are the kinds of things that parents can think about and can talk to their kids about.
Yeah, I like that emphasis on, talking about some of the internal signs or the physiological responses to that, and really being in tune and aware of that. Because oftentimes I think even adults are not fully tuned into that. And I think that can make a big difference just externally in our behavior too, and how we're managing and self-regulating ourselves.
Absolutely. And furthermore, for adults and kids alike, as you point out, to understand that when we have these physical symptoms, it doesn't mean that there's something wrong with us. It actually means our body is working well and doing the things it's supposed to be doing. But sometimes anxiety can be a little bit overzealous, let's say, and it can kind of be a false alarm when there's not really something to be worried about. So
I
that
like
can be
that you
helpful.
added that point that it can be normal, right? Normalizing some of it, right? And that not all of it is problematic, but it becomes problematic if it's creating some kind of impairment and not allowing you to do things
Exactly.
that would typically bring you joy, like accessing peers or accessing other friends or trying new experiences, like starting a new camp.
Exactly, right? That's what it's all about. There's nothing inherently wrong with having anxiety unless it kind of messes up your life in all of these ways. And that's when we want to jump in and help kids live their best and fullest lives.
Absolutely. All right. So if you're a parent and you're like, okay, I definitely think that there's some level of impairment and I could definitely use more support, why would you say it's important to look for evidence-based practices um, in terms of treating anxiety or just general mental health conditions?
Yeah. Well, what we think about, just thinking about evidence-based practice in general is that you always want to have some evidence based in science that the kinds of treatment you're receiving works. We think about when we go to the doctor for any kind of pain or medical condition or something like that, we would want to know that the medication or the medical procedure the doctor is suggesting has been tested before, right? Has been applied to people that have had our particular condition, and we want to know that it works. And so it's the exact same thing with psychotherapy. Researchers like myself and my team here are really dedicated to rigorously testing different psychotherapy approaches for children with anxiety disorders, exactly to determine which types of therapy work best for these kiddos and why do they work best? How do they work? So it's really, really important. I think that parents sort of approach therapy the same way they might approach any kind of medical care. They want to know it has a scientific backing. I would say another added benefit is that if a child and their family goes to receive therapy and it's not evidence-based, that can be a really frustrating experience, right? If they're not getting the most out of their time in therapy. Going to therapy is a big time commitment. It's a big monetary commitment. And it can be really frustrating and deflating and sort of weaken parents and children's faith in therapy if they're not sort of getting the highest quality, most rigorously tested treatments.
What are the evidence-based treatments, psychotherapy interventions to treat childhood anxiety and depression and OCD?
Great question. So there is a pretty large research literature that supports the fact that cognitive behavioral therapy, and I'll put a little asterisk on that and come back to that in a second, has the strongest evidence base in treating childhood anxiety, depression, and obsessive compulsive disorder, or OCD. The asterisk I want to put is that cognitive behavioral therapy is sort of a broadly defined approach, and different clinicians and therapists might implement it differently. So in our program here at Yale, for example, the way we do cognitive behavioral therapy has a really strong emphasis on the behavioral part. And that's because the research literature shows that having kids engage in exercises where they actively practice facing their fears is where the magic really happens in therapy and where they reap the most therapeutic benefit. And I know that you're a proponent of behavioral techniques as well, but the research really does support that. So that's where we focus, but other therapists might focus more on the cognitive piece, right? So talking back to our worry thoughts, reframing our worry thoughts. A combination of both is important, but so when you're a parent looking into receiving cognitive behavioral therapy, just know that it might vary a little bit in how it's implemented.
I'm so happy. Like my inner behavior analyst is just like jumping up and down right now. And it's making me think, I'm going to get a little bit specific here, but, it's making me think about a particular family I've been working with, and, this particular child, and I see a lot of the problem, like if you're going to pinpoint the problem, it's really around sleep, like this issue around sleep at night. And maybe there's a little bit of fear, but they're not able to clearly articulate the fear, even though, and I think it's important to mention real quick, when is it appropriate developmentally to start CBT intervention on a child?
Great question as well. So I think it is a misconception that you can't do CBT with young kids, but in fact, we often do CBT with kids as young as 6. With some really nice benefits. Now, of course, really skilled CBT clinicians and clinicians who have a lot of experience working with kids know how to sort of modify the treatment so that it's in developmentally appropriate terms. And so kids kind of get it and can meaningfully engage. But it can be done with kids as young as 6. Through adulthood.
Yeah. Okay, good. I was going to say 7, but like around the same period.
6, 7. Yeah. It depends on the kid, right? I mean,
Sure.
Development, of course, is not even across all children. And so we have some really, really young 6s who might not be quite ready for CBT and some who really are. So of course, know your child, and what they might be ready for.
So I asked that because this particular individual is, a little bit older than that, but close to that age, that's that 6, 7 range. So it's totally appropriate. And the problem area for this particular family is that, so it's a divided home. So in one context, one home, early on when the behavior was happening around bedtime, which I would actually classify as, like an anxiety type behavior, a lot of externalized behaviors, not wanting to lay down, getting out of bed, complaining that they're scared, lots of whining, lots of crying, those type of behaviors, and all around bedtime. And in one home, it was addressed through a behavioral intervention, and it's no longer problematic. Like the child isn't getting out. Sure, it takes a while, a little bit longer to fall asleep, but he's staying in bed. Versus in a different context, in a different home, that's not happening at all. He's coming to the parents' bed, staying in the parents' bed, doing a lot of whining and crying, and not really appropriate for the age, this child's age. And so there's so what behaviors would call like a huge behavior contrast across environments. And so what would you say, just kind of generally, without having all of the pieces of information,
Sure.
would you say that that is more of an anxiety based behavior?
Yeah, so I am smiling because this is something we hear all the time and see all the time in our particular program. Again, I think it's something that's relatable to a lot of humans, not just anxious children, that sleep is a time when a lot of worries pop into our head, right? We're finally, decompressing from the day, we're slowing down, we're trying to turn off, and it's a really prime time for worries to creep in. Not to mention that for a lot of children, sleep means separating from parents, and separation from parents can cause a lot of worry for kids, right? And so the first point I want to make is yes, this is something that we see very often and can be a sign of anxiety. And we actually have a really, really nice strategy that was developed by my mentor and my colleague, Dr. Ellie Leibowitz, who I'll talk, I'm sure, about a little bit more in a few moments. And we call it the sleep game. And it is a really, really simple way that parents can make a few key changes to how they approach sleep with a child who seems to be anxious about going to bed and engaging in some of those behaviors you mentioned: whining, crying, getting out of bed, requesting parents stay with them, to fall asleep, sleeping in parents' beds. This is a really nice behaviorally driven, parent driven strategy that can get kids sleeping in their own bed. So you can find out more about that game if you go to, well, actually, I would say the best way to do it is to go to YouTube and look up Space Sleep Game, and hopefully you should find it that way. But I can provide you more information on that.
Oh, that's awesome. That's gold, right? We want lots
It's
of
gold.
practical. Yeah, we want lots of practical information here. So I'll share it in the notes for everyone to easily access.
Perfect.
Thank you for that nugget there. And you brought up some key things that I wanted to get to, which is the SPACE program. And I want us, I'm hoping you can kind of give us a little background as the history of the treatment of anxiety disorders, anxiety and mood disorders, how it's evolved, and tell me more about family accommodations and the SPACE program.
Okay. Yeah. So historically, child anxiety disorders have been treated largely the same way as adult anxiety disorders. And by that, what I mean is the child meets individually with the therapist and either engages in some kind of talk therapy or an evidence-based treatment like cognitive behavioral therapy, which we discussed. Cognitive behavioral therapy for children and adults doesn't look all that different, right? Of course, all the terms and some of the ways that we present the tools and strategies are more suited for kids when we do it with kids, but the key crux of CBT is the same, which is that we're working on restructuring or reframing anxious thoughts that may not be the most realistic or most likely to occur, and we're working on exposure or facing our fears, right, in a sort of gradual way. What that treatment approach kind of is missing is the fact that child anxiety and adult anxiety are not identical in the way they present. Namely, what you just kind of alluded to, Michelle, is that when children are anxious, what they do is they turn to parents to help them regulate, to help them feel better, right? So going off the example you just gave of this family, let's say I'm a young child. I feel scared. I don't want to be apart from mom before I fall asleep. So what do? I show my distress to mom. I cry out. I whine. I leave my bed. I ask to sleep in her bed. And then what is mom left to do? This relates to this term we call accommodation. Accommodation refers to any changes that parents are making in their own behavior in order to alleviate their child's anxiety. So what does mom do on the other half of this equation? She probably gets out of her own bed. She comes to comfort child. She provides reassurance that it's going to be okay and sleeping isn't that scary. Maybe she invites the child to sleep in her bed because at some point she needs to fall asleep and she's tired and her resources are zapped for the day. So understandable. So we call this, like I said, in the context of child anxiety, accommodating the anxiety. And what research from around the world has found is that 95 to 100% of parents of an anxious child report engaging in multiple accommodations, usually on a daily basis. So what that suggests is that accommodation is so common, I would say even ubiquitous across parents of anxious families or anxious children rather, because as a parent, you want to make your child feel better. Of course, that's the hallmark sign of a good parent, right? But the problem with accommodations is that because they help children avoid or escape or alleviate their anxiety, children are not developing skills for regulating their own anxiety. And you can bet that the next time it's time for bed, the child doesn't have a belief that, oh, yeah, I can fall asleep okay and everything will be okay, but rather they turn back to their parent and the cycle continues. So, because of this process, what I referred to my mentor and colleague, Dr. Ellie Leibowitz, about 10 years ago, took this premise and developed a treatment that really deviates from how child anxiety has historically been treated, which is, again, a child meeting with a therapist. And he developed a treatment called SPACE, which stands for Supportive Parenting for Anxious Childhood Emotions. And in this treatment, the child is the client, the child is the patient, but we work exclusively with parents. And we work on reducing these cycles of accommodation in a really warm and loving and supportive manner.
Again, I'm cheering over here. I think it was probably, I want to say at least 4 or 5 years ago now, my husband comes home and puts down the research paper on space. And, have been working, well, he's been working a lot longer than I have in the field, but, a lot of the behavioral intervention work is really, really parent driven. And even the research shows us that when you're empowering the parents and giving all the parent skills, our job as clinicians is to work ourselves out of a job, right? And
exactly.
It makes sense, right? Parents are with them the most. And so it's beautiful how it's laid out in terms of explaining and then also putting a focus on the connection piece in a warm, loving manner, right? I think that sometimes can be missing.
Yes, and I think that many well-meaning parents and adults in general, right, respond to child's anxiety in ways that can sort of inadvertently or accidentally come across as invalidating. For example, even when we say things like, oh, don't be scared, or it's not that bad, right? We mean that in the most well-intentioned and loving way. But what the child hears is, I shouldn't be scared right now, or my anxiety isn't okay. And so we sort of also, in addition to reducing accommodations, we work on increasing the most supportive and validating and confident responses to a child's anxiety, so that a child can really start to internalize the belief that, you know what, even if I'm anxious, I can work through it. It will pass. I'll be okay. And that is one of the greatest gifts that parents can give to their child, is that confidence that they have the internal skills and tools to get through anxiety.
Language matters, right? The language does matter. And that's all about, that's the cognitive piece of the work, and empowering the family.
Absolutely.
I am just so excited about your work. I hope we could have you back for a part 2. But before we go, I have 2 more questions for you.
Absolutely.
More personal. But how has your work impacted your personal life?
it has impacted it in more ways than I can get into. I am not yet a parent. I'm I guess a quote unquote dog mom of a very anxious 2-year-old Australian Shepherd. But aside from that, I don't have my own kids. But one of the most gratifying ways that my work has impacted me is just seeing that even though this is a treatment for childhood anxiety disorders, and we make that very clear to parents when we work with them, right? Parents are not the problem. They're just part of the solution, right? The same way parents help their kids with all sorts of things, they can help them overcome their anxiety. But a really, really, really nice sort of cherry on top of this treatment approach, which has been shown by our research studies on space, is that parents wind up feeling more efficacious, less stressed, more confident in their own parenting. And I think that's just a really nice take home message, right? Is that when you have a plan for how to help someone, you can feel more empowered yourself. And so there's kind of this beautiful parallel process, I think, that happens in therapy, at least for me personally, where I'm sort of being this supportive presence for parents so then they can turn around and be that for their child. And it's just been really gratifying and wonderful to form these relationships with families through my work.
Your work is so meaningful. Thank you so much for all your work and your dedication to the field, and for just thank you. Big hugs to you.
Big hugs back. Thank you so much for your excitement and enthusiasm. We're certainly excited about it over here.
And I'm excited to read Breaking Free of Child Anxiety and OCD, a scientifically proven program for parents. This is by your colleague, Dr. Eli Lebowitz. I'm excited to read it and share it with my families. But where can our listeners find out more about you?
I would say the best place to find out more about me is really through the SPACE website. Families can go to www.spacetreatment.net. And on that website, there is a wealth of resources ranging from a list of practitioners who have been trained in this SPACE treatment model, to links to different books and research articles and videos, I believe including that sleep game I mentioned earlier. We also just came out with a sort of mini documentary style film about two families and their journey through space. And I make a little cameo in that. So I would say go to that website and you'll find all the resources you need to learn more.
And I watched that. It was very powerful. And that's how I found out about you.
Awesome. Glad to hear.
Thank you so much, Dr. Etkin, for joining us today. We are excited to have you here, and hopefully we'll have you back for part 2.
I'd love it. Thank you so much.